Today we are going to talk about pregnancy and development. So if you have ever been pregnant, you know that your body changed a lot in order to incorporate the fetus that is growing inside you, right? There are a lot of things that happen during pregnancy to allow for that fetus to grow and develop. And that is what we are covering today. So there are a lot of adjustments that are happening to basically make room and nourish that fetus and to prepare for the actual birthing of the child, right? So gestation is the same as pregnancy, and it usually lasts an average of 266 days from conception until childbirth. The gestational calendar is measured from the first day of the woman's last menstrual period. So basically, the last time the woman had a period is day 0. And the next day then is 1, and that is where 266 days is then counted from. And usually, pregnancy lasts about 280 days or 40 weeks. Sometimes you hear the term full term, and that would mean 40 weeks, okay? Oftentimes, things are measured in the trimester, and there are basically three-month intervals in a trimester term. So if you are in your first trimester, you are in the 1st through 3rd month of pregnancy. The second trimester is the 4th through 6th. And then the last trimester would be the 7th through the 9th month of pregnancy. Conceptuous are all the products of conception. This means the embryo or the fetus, the placenta, and all the associated membranes. The blastocyst is the developing individual, and it's a hollow ball for the first 2 weeks. We then call it an embryo from day 16 through 8 weeks, and then we call it a fetus from the beginning of week 9 until birth. The fetus is attached by way of an umbilical cord to a disc-shaped placenta. And this provides the fetal nutrition and waste disposal. It secretes hormones that regulate pregnancy and mammary development and fetal development. And a neonate is a newborn until 6 weeks. There are many hormones that are associated with pregnancy, right? There's a lot of things that kick in or subside depending on what is exactly happening. And the strongest hormones that we see influencing pregnancy are estrogens, progesterone, HCG, and HCS. All are primarily secreted by the placenta. The corpus luteum is an important source for the first several weeks, and if it is removed before 7 weeks, this can cause abortion. From week 7 to week 17, the corpus luteum degenerates and the placenta takes over with endocrine function. So HCG is secreted by the blastocyst and the placenta. It is detectable in the urine at 8 to 9 days after conception. So this is the hormone that is playing a role if you take a home pregnancy test kit and you get a positive. That is because it is detecting the HCG in your urine. It also stimulates the growth of the corpus luteum, and it secretes an increasing amount of progesterone and estrogen. Estrogens, they increase to 30 times the normal dosage by the end of gestation. The corpus luteum is the source for the first 12 weeks until the placenta takes over, and which happens gradually during 7 to 17 weeks. This causes tissue growth in the fetus and the mother. So the mother's uterus and exterior genitalia will enlarge. The mammary ducts will grow and the breast can increase to nearly twice the normal size. And the mother's pubic symphysis and pelvis will widen, basically preparing for labor, for childbirth. Progesterone is secreted by this placenta and corpus luteum, and it suppresses secretion of the SFH and LH, preventing follicle development during pregnancy, right? Because during pregnancy, a woman does not menstruate. Therefore, we don't have the FSH and LH being released like we would if a woman was not pregnant. It also suppresses the uterine contractions because there's obviously something in the uterus, and it prevents menstruation, which is what I've just mentioned. It also stimulates the development of the acini in the breast in another step towards lactation. So it's a slow process. Things are kind of gearing up and getting ready for that woman to birth the child and then basically be able to feed it. HCS is another hormone, and this we see the placenta begins to secrete this at about 5 weeks. It increases steadily until term in proportion to the placental size. The effects of it are similar to growth hormone, but a bit weaker. It seems to reduce the mother's insulin sensitivity and glucose usage, therefore leaving more for the fetus, more nutrition for the developing fetus. The woman's pituitary gland grows about 50% larger during pregnancy, produces markedly elevated levels of tryptophan, prolactin, and ACTH. The thyroid gland becomes 50% larger under the influence of the HCG, the pituitary tyrotrophin, and the HCT from the placenta. This increases the metabolic rate of the mother and the fetus. And this, then we also see the parathyroid glands enlarging, which increases the osteoclast activity. Osteoclasts basically take away from the bone, take calcium away from the bone and put it into the bloodstream, again, to nourish the fetus. ACTH stimulates the glucocorticoid secretion, which serves primarily to mobilize amino acids for fetal protein synthesis. Aldosterone secretion also rises, promoting fluid retention and increasing a mother's blood volume. Relaxin is secreted by the corpus luteum and the placenta, and this synergizes the progesterone in stimulating the multiplication of decidual cells. It also promotes growth of blood vessels in the pregnant uterus because we want blood to be able to get to the fetus. So lots of things happening within the mother to make sure that the fetus is receiving the nutrients that it needs. There are a lot of things that go on physically also in a woman's body during pregnancy. Many people experience what we call morning sickness, which is usually feeling nauseated when you first get out of bed. And this usually happens during the first trimester. And then it sometimes goes away. It usually does. And we aren't really sure why that happens. It's probably due just to all these changes going on in the female's body. We can also see constipation and heartburn, and this can be due to reduced intestinal motility, meaning all of a sudden you have something growing inside of you, and it can put pressure on other parts of the body, especially on the stomach, which can cause a reflux of gastric contents into the esophagus, which is which is what we see when we have heartburn. It's basically like a reflux coming up. So if there's a fetus growing inside, it can actually push on some of those sphincters that would usually have that gastric fluid contained. We see differences in the metabolism. The BMR rises about 15% in the second half of gestation. And this can cause an appetite to be strongly stimulated. And again, that is because a female is growing another human. And the average healthy weight to gain for most women is about 24 pounds. This includes the fetus and all the liquid that is contained around the fetus. Nutrition. The placenta stores the nutrients in early gestation and releases them later in the last trimester. The demand is especially high for protein, iron, calcium, and phosphates. You need extra iron during late pregnancy, or the female can become anemic, which is when you don't have enough iron within your blood. Vitamin K can be given in late pregnancy to promote prothrombin, which synthesizes in the fetus. And this minimizes the risk of neonatal hemorrhage, especially in the brain. Vitamin D supplements can help ensure adequate calcium absorption to meet the fetal demand. Folic acid reduces the risk of neurological fetal disorders. Spina bifida being one of them. Usually women who are pregnant take a folic acid supplement, basically just to make sure that there aren't any neurological disorders within the fetus. And here it says it can even be started before pregnancy. So if people are trying to get pregnant, sometimes they actually start taking folic acid prior, because sometimes you don't know right away when you're pregnant. So it just kind of covers all the bases. The circulatory system. By the full term, the placenta requires 625 milliliters of blood per minute from the mother. So this means that the mother's blood volume rises about 30% during pregnancy. And this is just because all of a sudden, there's so much more blood being needed. The blood supply to the fetus is constantly going. So in the end, the mother has about 1 to 2 liters of extra blood within her own system to nourish the fetus. The mother's cardiac output will rise 30 to 40% above normal by week 27. And then it falls back to normal during the last 8 weeks. And that is because the female's body starts to kind of regulate, and there isn't a lot of extra growth within that 8 weeks. There's things being detailed, but the baby may not be growing in mass that much anymore. The pregnant uterus puts pressure on the large pelvic blood vessels and can interfere with venous return from the legs. And this sometimes can be seen in either hemorrhoids or varicose veins and edema in the feet. Edema would be swelling. So some pregnant women at the end of pregnancy have some swollen feet, and they have to elevate them. I actually have 2 children, and that happened in both of mine. By about month 8, if I was on my feet a lot, my ankles would really swell up, and I would have to get to a point where I could sit and elevate my legs so that that pressure was off and the fluid could be reabsorbed correctly. The respiratory system. The respiratory rate remains constant, but the tidal volume and the minute ventilation increase about 40%. And there are some reasons for that, and it is because the oxygen demand rises in proportion to the woman's increase in metabolic rate, and the increasing needs of the fetus. Progesterone increases the sensitivity of the woman's chemoreceptors to carbon dioxide. So ventilation is adjusted to keep the woman's arterial PCO2 lower than normal. And this promotes carbon dioxide diffusion from the fetal bloodstream into the maternal blood. The term air hungry comes from the pressure on the diaphragm from the growing uterus. So sometimes the woman can have like kind of labored breathing. And this again is because there's something inside that is growing and taking up space that hasn't been there before. So again, by like the last month or so, the woman's respiratory system kind of gets back to where it was. And that is because the pelvis now is starting to expand and the fetus is starting to drop. And this is taking pressure off the diaphragm. And these things are happening because the body is getting ready to give birth. The urinary system. Aldosterone and the steroids of pregnancy promote water and salt retention by the kidneys. The glomerular filtration rates increase 50% and urine output is slightly elevated. This enables the woman to dispose of both her own and the fetus's metabolic wastes. The pregnant uterus can compress the bladder and reduce its capacity. So many times pregnant women have to go to the bathroom a lot. There's a frequent urination rate and sometimes incontinence, which is uncontrollable leakage of urine. And again, that is because that fetus is pushing on everything inside that woman's body. The integumentary system. This is the skin. And we can see that the skin grows and expands in the abdomen and the breasts. We can see fat being deposited sometimes in the hips and the thighs. We can see stretch marks sometimes resulting, and that is from a tearing of the stretched connective tissue. Usually they're kind of red marks at first, but usually they do fade out. And this is just because the woman's body is growing to, again, accommodate that fetus. Melanocytes can increase in some areas, and sometimes the areolas become darker, and sometimes you get what's called like the pregnancy line, which is the linea alba down kind of from the belly button down to the vagina, and you get a little dark line there, and that is because of the melanocytes. Activity is actually being increased. You can also have what's called the mask of pregnancy, which could be a temporary blotchy darkening of the skin over the nose and the cheeks. And this is just because all these hormones are in full force and they are changing the woman's body so extremely. So sometimes we see these things happen, and usually that mask will disappear after pregnancy. So uterine growth and weight gain. The uterus weighs about 50 grams when not pregnant, and it weighs about 900 grams at the end of pregnancy and reaches almost to the xiphoid process, which is the tip of your sternum. And then there are some values given there. As I mentioned, 24 pounds is about the going rate for a weight gain during pregnancy. Everyone differs. I was at about 24 for the first child, and the second one, I think I was almost 40 pounds. So again, it differs. It depends on how many children you've had. It depends on your physical size. There's a couple different things that play roles there, but there's a breakdown of the pounds. So there you have it. Pregnancy in a nutshell, and fetus development. It's a lot of work on the woman's body. A lot of changes have to take place in order to not only give room for that fetus, but to nourish it. Hope you enjoyed. Please let me know if you have any questions or concerns. Take care.